This is Solve It for Kids.
Hello, my amazing and curious friends. My name is Jennifer, the Dean of all things STEM and STEAM, and this is Solve It for Kids, the science podcast that gives kids and families a peek inside the real world of scientists, engineers, and experts as they solve problems in their jobs using creativity, cooperation, and critical thinking. And now please welcome to the show my podcast partner, Galactic Space Geek, Jeff Gagne.
Hello, Jennifer, and hello, listeners. I absolutely love when we're about to jump into an episode that's not ocean, it's not space, our usual stuff, and we're going to be talking about something I don't know if I have ever considered before.
Yes, this is going to be a very exciting episode. What problem are we solving today?
What do you do when a tiger has a toothache?
What do you do when a tiger gets a toothache? Well, I think this is going to be an excellent answer here that we all want to know. Who is our guest today, Jeff?
Our guest today is just the right person to answer. We have the wonderful Dr. Carrie McCullough, a retired zoo dentist.
Welcome to the show, Dr. Carrie.
Thanks for having me, Jennifer.
We are so thrilled. This is such an exciting question. I mean, hello, zoo dentist, right? Those two words don't always go together.
No,
right.
But, okay, so I have a question. As a kid, did you always want to be a dentist?
Actually, I did not. I grew up on a farm, so I was always around animals and was always caring for animals.
Okay.
But I actually wanted to be a pediatrician.
Oh,
but
me too, by the way, I did.
Yeah. Well, and our family vet always wanted one of the local kids to take over his practice. And so I did my first surgeries, like doing suturing and stuff when I was like 10 or 12 years old, because he would start a process and he would talk me through the rest of it, hoping that, and he did this with a lot of the kids, hoping that somebody would take over his practice, and then none of us did. So I felt a little bit. Yeah. And then my dentist growing up wanted me to take over his practice. So when I went to undergrad at Otterbein College, one of the things that you had to do at the time was have 3 related internships. Your junior. And so I chose to work with several physicians, one of which was a pediatrician. But my mom works for an ophthalmologist, so she set it up so that I would see several physicians. And then I spent some time with a vet in town, and I spent some time with 2 dentists. The vet was very, very quiet, very introverted, kind of like my vet back home. Didn't say a lot. And I was very extroverted. And I thought, well, this looks like fun, and I'm having a good time watching the procedures and stuff, but I can't spend the rest of my life in a job where nobody talks to me,
Yes.
And with the physicians, that was about the time that managed healthcare first came into the state of Ohio with the HMOs. And every one of them said, 20 years ago, I would have told you to go for it, but now it's not fun anymore. I spent the time with a dentist for a semester, and they were a blast. They would take extracted teeth and, teach me how to prep them, and I would fill them and just do this beautiful artwork with them. And it was not only sciencey, but it was artistic. And we had fun, and they're just like, yeah, be one of us. So that's how I wound up being a dentist.
So the most enthusiastic one got you, right? Is what you're saying.
Yeah, that got my attention. It's like, these guys are having fun. The other one's not so much.
Imagine wanting a job or a career where you're going to have fun.
Yeah.
Oh my.
Right?
Okay, so how do you transition from dentist to zoo dentist?
Well, funny story. It just one of those things that just happened. I was an adjunct associate professor of pediatric dentistry at Ohio State.
Okay.
And there were 3 doctors, and we always did something special to celebrate birthdays. So one of the doctors wanted to go to the zoo for his birthday. So we did a zoo day.
Okay.
And I made the offhand comment that wouldn't it be fun to be their dentist, like meaning the animals?
Oh,
The director of the clinic said, I play handball with the zoo dentist and he's retiring. And I just thought, oh, how about that? What a coincidence. Didn't give it another thought. A few days later, I get a call from the head vet at the Columbus Zoo. And he says, so I hear you want to be our new dentist. I'm like,
Oh my gosh.
okay. So it was on the job training. I spent a lot of time in zoo conventions, just like I would go to the dental conventions every year. Where you learn the new classes, you take the CE courses. Right. Well, I wound up going to a lot of the veterinary courses too. And it's funny because I have a couple high school friends that are veterinarians and, they like walk in and see me there. It's like, wait,
are you lost?
Here?
Aren't you a human dentist? Why are you in here?
So anyway, so that's how I learned. It was a lot of on-the-job training. But the dentistry, I guess at that point, the dentistry was the more important part, and the animal you just kind of pick up as you go.
Okay. So what was the first animal you worked on, and were you nervous?
It's funny because I wasn't really nervous, and people always ask, do you worry about them waking up? And I never did. My first animal was a gorilla. Oscar was his name, and he was a 35-year-old silverback, and he had stopped eating, and they didn't know why. So they brought myself and a gastroenterologist in because they figured between the two of us, you start at one end, end at the other, somebody could figure out what the problem was. Well, it turned out that he had a bunch of food impacted between his mandibular molars in one quadrant.
Oh, wow.
Which caused an infection and would have to be incredibly painful because they eat like grassy, really fibrous stuff. And so that's stuck in your teeth and pokey. And so I did a special type of deep cleaning called a root planing. And I just got all of that material out, smoothed up the roots, got the gums reattached, and he was back to chewing in no time. So.
Oh my gosh. We're going to skip over the whole got the gums reattached part.
I was trying to skip over that.
I mean, so who puts him under? I assume you have an anesthesiologist or somebody, the vet who's in charge of that? The vet does? Okay.
The vet does, but it's funny because in the states where I practice, when doctors could work on animals, the rule was that veterinarians had to be somewhere on the premises. They didn't necessarily have to be in you.
Oh.
So a lot of times they would get you, they get the animal intubated, they would start the anesthesia, and then they're off doing something else. So it's just a vet tech and myself. So you have to be very careful not to pull the tube out, and you got to, keep an eye on them to make sure that they're staying under. So
definitely keeping an eye on that.
And when I was at Columbus, I never worried about an animal waking up. At Minnesota, at the Minnesota Zoo, I actually have had a couple animals wake up, but it's because they do a different type of anesthesia there. In Columbus, they used IV anesthesia.
Okay.
In Minnesota, they used inhalation anesthesia. But two of my pregnancies were while I was at the Minnesota Zoo. When you're pregnant, you can't be around that inhalation anesthesia. So they had to use IV, and they just weren't as used to using that. So there was always a syringe of ketamine by the head. And then when the animal would start to wake up, then I would inject them and they would go back to sleep.
Oh my gosh.
But it was a fast way to clear out a room. When the tigers were one of my patients, if I had a tiger, everybody wanted to come and see the tiger. So you would have a room full of donors, you'd have the CEO, everybody would be in there. And that tiger started waking up, and you've never seen a room clear out so fast. And it's a big deal. He's asleep. No big deal.
That was a perfect transition for us into our main question of what do you do when a tiger gets a toothache?
Yeah.
Well, it depends on what's causing the toothache. So the first thing you have to do is figure out what's causing the toothache. So the zookeepers usually notice a change in behavior, or they might even see an actual open wound, and that's going to get them to call me to come.
Oh, wow. Yeah.
So when they come in, I'll do a thorough exam. Usually it's a pretty obvious, a broken tooth, or there is an open wound. So, but after the exam, you also take, x-rays.
I was going to ask about that. Okay. Yeah.
Yep. So most of the time with tigers, a toothache is a broken tooth. And if it's broken into the pulp, which is where the nerve and blood supply is located
Right.
within the tooth. So if that's the case, then we actually have to do a root canal. And to do that, we actually cut into the crown of the tooth.
Right.
And then you use files. And you start with a smaller file, and then you use bigger files, and you pull out all of the blood supply, all of the nerves, and you get it nice and clean. You rinse it out with a solution. You get it really, really dry, and then you fill it with a rubbery material called gutta percha. And then to top it off, you put a silver filling on top.
So
it's silver filling.
A silver filling.
So there's a tiger walking around with a silver gangster tooth.
There's lots of tigers walking around with silver gangster teeth.
Oh my god!
No kidding.
Yeah.
So I was gonna ask that. So like in a human, of course, you're gonna put in, the fake tooth or whatever,
Yes.
or you're gonna leave the original tooth if you can and do the root canal underneath it and whatever.
Right.
But in a tiger, so can you explain why you don't leave that tooth?
Why we don't do? Well, we still leave the tooth in.
Oh, okay.
So we leave the root part in.
Okay.
The amount of crown that we leave in depends on the tooth. Like the molars, you can leave more. You just put in a nice, good silver filling.
Okay.
With the canines, ideally, like with people, the front teeth, you can just fill it with, we would actually use a white filling on a front tooth.
Right.
Back teeth, you crown. And the reason you want to crown those back teeth with people is because they take heavier forces. And once you've taken out the nerve and the blood supply, that blood supply is what keeps it viable. You get rid of that, the tooth actually dries out over time and gets more brittle. So you put a crown over that to help distribute the forces and keep it from breaking over time. With tigers, it's kind of the opposite. Those front teeth are where they're using to actually,
rip and tear.
Yeah. Or if they get into a fight, which sometimes they do get into fights in zoo enclosure. So back in the 70s, they actually, this was at Columbus Zoo, they tried putting a crown on a tiger canine to see what would happen.
Yeah.
And of course, there were no impression materials at the time, but this new innovative type of potato chip came out on the market about the same time, Pringles.
Yes.
So they used a Pringles can as the impression tray, put the impression material inside the Pringles can, put that on the tooth before they cut into it. So they would have that to make a mold of the tooth. So a lab could crown. Yeah. And then they did the root canal, they put on the crown and turned them loose to see what would happen. And the crown just kept coming off. That cement that we use works great for small human type teeth, but a tooth the size of a tiger canine that can be, the crown can be 3 inches long.
Oh, wow.
They don't hold up to that. So they went back to doing it the old way, which is where we actually cut the crown of the canine off. And it goes back to that. If I left too much tooth on that canine, with nothing to protect it, it would just keep breaking and breaking. You have to worry about the risk that, eventually would it break below the gum line, because once it breaks below the gum line, then you have to extract a tooth because there's no way to really restore it.
Yeah.
So we just leave it at the gum level now.
That makes sense.
It does. So how do you know initially that a tiger has a toothache?
Well, that's where we rely on the zookeepers. So they're looking for changes in behavior. So maybe they stop eating or they'll only eat softer food.
Okay.
They might see them chewing on non-food items, kind of like a puppy teething or a baby with a teething ring. If your tooth hurts, when you're chewing on something like a teething ring or your puppy's chewing on your shoes, it applies counter pressure, and that actually makes it feel better. Same thing happens when an animal has a toothache. It starts to hurt, so they'll start gnawing just on like branches or something, just to kind of get that little bit of counter pressure relief. So if they see that they know to call me. If they see an open bleeding wound, they know to call me. Sometimes the animal has no symptoms and they'll be in for something entirely different. Maybe a kidney exam, or the cardiologist is coming in for a follow-up or something. And the zoo, the veterinarians always do a cursory exam before they do anything else. And so they may find a growth, maybe a cancerous growth or a viral growth or something, or they may find a broken tooth that might not be into the pulp to actually hurt them. But if it's really sharp, then it'll cut up the inside of their mouth. So then I'll just come and, file that down so it's nice and smooth.
So how many tigers have you worked on? I mean, do you have a number or is it just so many?
It's been over 30 years. So I mean, like 35 years. So I couldn't tell you, but the two most memorable ones, though, the one that I worked on was a white tiger named Ison at the Columbus Zoo.
Oh, wow.
Okay.
And she, of all the cases that I've had over 3.5 decades, hers was the most complicated. She was a rescue tiger from a roadside zoo.
Oh, wow.
And they do something that it's a horrible thing, but they used to do this thing called disarming, where they would cut the canines off at the gum line when they're young, so that if they would attack the zoo owner or whatever, it would be less lethal. And then they would just shove some silver filling material in. Well, that's not a proper root canal. And so those things are always going to blow up. Well, a neighbor of that roadside zoo or somebody had called into our zoo to say, hey, there's some animals that are being abused and they're being neglected, not cared for. And so, as often happens, the zoo's vets will go out and verify it and then bring them in, and then we'll take over their care. By the time we got here, she did have an open wound, seeping like and bleeding under her jaw.
Geez.
And so when we got x-rays and everything, it had progressed to cause something we call osteonecrosis, where the bone actually starts to die. So we had to take that tooth out, and that took me a good 3 hours.
I was going to ask, how long does this take?
So imagine, a 3-inch just on a tiger. Well, the root's even longer and it curves, so you can't human tooth. So you have to remove all the outer bone, and then you can kind of wedge elevators and everything in once you cut like a little trough around the roof.
Right.
The problem is that bone is just so dense that it's just a lot of hard work to. And you can cut a little bit, and you have to give it a break because you don't want the bone heating up too much, because she's already lost a lot of bone. Yeah. You don't want it to cause any more to die. So you eventually can get a trough around there and then kind of ease it out of there. But then you have to scoop away just enough of the diseased bone. And then you take another little margin out to make sure you get all of it.
Right.
But you don't want to take too much, because then it's not going to grow back. So then you have to worry about them breaking their jaw if they're chewing on a bone or something. So it's a delicate balance.
So what happened? Was she okay after you did all of this?
She was okay, went on to live a nice, happy, healthy life.
That's awesome.
So, and then the other most memorable tiger he's my most famous patient. His name is Globus. And he was on, I believe it was the February of 1998 cover of National Geographic.
Oh, wow.
So
No
kidding. He was born in Russia to a first-time mom. He had a brother. The brother didn't survive. The mother abandoned both of them.
Oh.
So they brought him into their little sanctuary in Russia, and the Minnesota Zoo was called. So our vets went over and brought him over. He had so many congenital issues. He was always seeing me. He had a retained baby tooth. Usually the adult tooth, as it's coming in, will resorb the root and push it out.
Yeah.
It was just not lined up the right way for him. And so as his adult canine came in, his baby canine stayed there. And so we got a gum infection. So I had to take that little guy out. He had a couple root canals with broken teeth. Yeah. So he was my frequent flyer.
Yeah. But you were able to fix him all up, right?
To fix him all up. Yes.
That's awesome.
Yeah.
That's incredible.
He's the cute one though, because he was the Russians started bottle feeding him sugar water, and then we got him over and bottle fed him formula.
Right.
And because of that bonding, He was actually pretty domesticated, which you never trust a wild animal like that to be 100% domesticated, but
Right.
he was as
Agreed.
domesticated as a wild animal could get. We always, before a procedure, the night before, they have to go into an enclosure so that there's no food or water because we're putting them under anesthesia.
Right, right.
Like with people. And then we go back to put him out. So we would go back and he would see the vet coming with the dart gun and he would just lay down in front of the bars and just be like, yeah, let's just get this over. Where any other animal gets up and they see us coming and they start pacing and they shoot the dart in it. And they're trying to pull the dart out. And Globus was just like, okay, let's do this.
Oh,
Wow.
Yeah.
And as you were explaining that really quickly, I just Googled that cover. What a majestic looking animal.
That's when he was fairly young. I mean, he grew into a marvelous animal. He was just gorgeous. I'm a little biased, but he's the most beautiful tiger ever. He's the sweetest tiger ever. So,
Question. How big did tigers grow?
males can be like 400 pounds. They're big.
Wow.
Yeah.
Wow,
So-
what a big animal.
And those paws, I mean, somewhere I've got, somewhere I have a picture of my hand against his paw when he was asleep.
Oh my
And
gosh.
the paw is it's huge.
Oh my
Wow.
gosh. It's just beautiful animals. So what are some of the other animals you worked on? Because I know you've worked on tigers, but and also you said a gorilla, but what are some of the other ones?
One you probably wouldn't think of is a dolphin.
Oh,
We had a dolphin at the Minnesota Zoo that had a black tooth. And so the trainer asked the vet if I could come and take a look. And so I did. And those things are so stinking smart.
they are amazing creatures. Yeah.
Yeah, oh, they are. I just sat on the edge of the pool, put my legs in the water, and the trainer gave her a cue, and she popped up right in my lap and opened wide, and I was able to give her a full exam and do the tapping on the teeth and everything.
Wow.
Nothing bothered her, so didn't do anything except, occasionally go back and check again just to make sure it still wasn't bothering her. So my guess was that when she was younger, she bit down on something hard enough to actually cause a little bit of internal bleeding, and that's what caused the discoloration. But
okay.
didn't cause an infection, didn't break. So, if it's not causing them any problems, then we don't do anything.
Yeah. So what are some of the other ones?
Lots of otters, river otters,
Huh.
sea otters,
Okay.
lots of wolves. Seen a lot of wolves. What
Oh,
else?
wow.
About 10 years into my time at the Minnesota Zoo, we built a farm.
Oh.
And we actually had a working farm. So we had a dog. We had a border collie that would actually herd the sheep.
Sure.
And she had a broken canine playing fetch. And there's
So
actually
you had to do. So you've done tigers and gorillas, and then you do
And then a
teeth on a
dog.
dog. A dog.
Yeah, but a dog is really not that different than a wolf. So
That's true.
but I don't do dogs outside of zoos. So
Right.
I've had friends ask me, "Hey, can you do my show dog?" Yeah, no, I can't. Sorry, not allowed. Oh gosh, what else? Sun bears. Sun bears have a lot of gum disease, a lot of perio problems. So the ones that wind up having a lot of bone loss due to periodontal disease, they wind up getting put on a 3-month recall, just like people. And so it's like, okay, we're going to schedule a checkup every 3 or 4 months just to make sure things are still good.
Wow.
So
The way you explained that led me right to where I was thinking. I really think that the average person, we don't really think about how animals, because we're an animal as a human, animals have a lot of the same issues
Mhm.
that we do, to include dental issues.
yeah.
Wow.
Yeah. And you got to think too, in the wild, what do they do with no dentist?
Yeah.
In some
Right.
cases, they recover a lot better than we do, but a lot of the cases, they would die because
Yeah.
there's no one to fix these problems. And then they stop eating and they
Right.
starve to death.
Yeah. So, I mean, this might seem like kind of like I'm answering my own question, but so you work on them pretty much the exact same way you work on humans? Do you use the same dental materials that you use on humans too?
Yes, the same materials. Yes, the same instruments for the most part. Yes, but you get
Okay.
into the bigger animals like a tiger canine, and you have to be
Yeah.
more creative because human tools aren't big enough, and even veterinary files aren't big enough to reach
Oh,
Oh.
wow.
to the apex
Okay.
of a tiger canine. So you have to get creative. So you go to the hardware store and you start buying these bandsaw blades,
Oh my
bandsaw
gosh.
blades, and you sterilize those and you use those for files. So
Wow.
you
Wow.
get really creative.
I mean, yeah, I guess that's what you have to do if you're just kind of starting a whole new science type of thing, right?
Yeah. Yeah.
So is there an animal out there in the world somewhere that you've never worked on that you would like to?
That I would like to. Probably a giraffe.
Oh.
Because we had those at
I
Columbus,
love
but none
giraffes.
of them had any problems. We didn't have those at the Minnesota Zoo. The Minnesota Zoo was more of a conservation zoo as opposed to an entertainment zoo. So we had a lot more endangered species. So we didn't have giraffes and elephants, but we did have those at Columbus. They just didn't need me while I was there.
Okay.
So did you do regular checkups on them too, or was that the vet did the checkup and then they called you if there was a problem?
The vets did the checkups and called me a
Okay.
problem. Yep. And
Okay.
same thing with cleanings. I only did the cleanings if they needed a cleaning while I was already there for something else, then
Right.
I would do that. Otherwise, the vet tech would do the cleanings.
Did you ever go visit your patients afterwards? Be
Oh,
like,
yeah.
look, that's the tiger
Yeah.
or gorilla I worked on. Hi.
Yep. Take my kids to see them. I would take the kids and we would go to spend the day at the zoo. And a funny mom and kid story. When my son was probably 2, they asked me if I could come and take a look at a snow leopard that they had. And so I'm like, yeah, I'm going to the zoo anyway. So how about if I pop in then? So we went in, he got to pet the leopard and just had this great, you would think great. And then Jim's like, oh, hey, you have to see who we have back in quarantine. So like, oh, let's go. They had a baby moose. The mother had been
my
hit by a
gosh.
car in Michigan, and
Oh,
Michigan
no.
DNR called the Minnesota Zoo and said, hey, can you come up and get this baby? Because we don't know how to raise it.
Yeah.
So my son, this 2-year-old, got to go pet the baby moose, right? Really
Oh,
cool,
my
you would
goodness.
think, right? No, what does he do the whole time? He's petting the leopard, he's, petting the moose, and he's like, Mommy, I want to go see the turtles. I want to go see the turtles. He was not happy until we got into the main part of the zoo and he got to see a turtle on the other side of the glass. Didn't get to pet, it was just same old turtles. Like, you get to pet the baby moose, But
Aw,
yeah, kids,
I'd
what
pet
are
a
you gonna
baby
do?
moose. Are you kidding me? Wow.
Yeah.
Oh,
Oh,
cool.
he was adorable.
Yeah.
Bruce the moose.
Bruce the
No
moose.
kidding.
There
Bruce
you
the
go.
That
moose.
is, you have so many fun stories
Yeah.
about this. So pets, regular domesticated pets, dogs and cats, owners do sort of teeth care and mouth care now. Dogs have
Mhm.
specific things to chew on that help out.
Yep.
Do animals that are out in the wild, are they practicing any sort of, do they know, instinctively how to take care of their teeth? You had talked
Well,
about chewing on branches and stuff.
I wouldn't say they know instinctively how to take care of their teeth, but the way they eat just kind of naturally lends to that.
Ah,
Because their prey is
Mm.
animals, they eat the flesh, but then they chew on the bone. And that bone is like giving them a
Ah.
biscuit or something. And so
Okay.
as
Okay.
it breaks and they're chewing on it, then they get that it manually will take off.
Okay.
any
Right.
flesh.
So
Right.
evolution's just kind of working itself out right there.
It
Yeah.
just happens to work out naturally.
Okay, so before we get to the challenge, I want to ask you if one of the kids or a young person or whatever is listening to this, how would they become a zoo dentist today?
So today the laws have changed. When I did it, I started over 35 years ago. And back
Okay.
then, the vets didn't get a lot of training in dentistry. And as a matter of fact, they did get a lot of training in a lot of the specialties. So all of the medical specialists were human doctors.
Okay.
Now they're actually teaching a lot of dentistry. So if you want to be a zoo dentist now in most states, you would have to be a veterinarian. So you would go to veterinary school and then you would do an animal dentistry residency.
Oh, okay.
Okay.
So
I
you
see.
become a vet first, and then you do like 2 or 3 years learning about animal dentistry, and then you become a zoo dentist.
Yeah.
Sounds like such a cool specialty.
It does.
It's fun.
It sounds really fun, and you get to meet all of these amazing animals, and more importantly, help them, right?
Mhm.
Help them survive and eat and have, productive lives within the
Mhm.
habitats of the zoo.
And live much longer than they probably would have without good medical care.
Yes.
Right.
Exactly. Oh my gosh, this is so fun, and I learned so much about zoo dentistry. But we are at the point in our show where we ask our guests to give our listeners a challenge. So I'm curious what your challenge is, Dr. Carrie.
Well, my challenge is for your listeners to look up not only how many teeth an adult tiger has, but also how many of each type of tooth. So how many incisors, how many canines, how many
Ooh.
premolars, how many molars. And if they
Ah,
want bonus points after they've looked that up, compare that to human teeth.
Ooh.
okay. And I definitely want people to also look up that size comparison. I was thinking, as soon as you mentioned 3 inches, I'm looking at my fingers and I'm like, whoa,
Yeah.
I did not realize tiger teeth were that large.
Yep. Look at your house cat and then compare their canines to
Oh my gosh.
Korean
Oh,
tiger
very
canine.
good.
That's a really
Huge
good one.
difference.
This is
Oh.
going to be good.
Yeah, well, you've given us so much cool information about being zoo dentists. We hope maybe someday some of these people that are listening might go out and pick this as a career. Thank you so much for being on Solve It for Kids, Dr. Carrie.
You're
you,
welcome.
Dr.
Thanks
Carrie.
again for having me.
What a fun episode, jumping into a topic I've never thought about before, but now I've got all sorts of questions, and I am going to be thinking about every different type of animal's teeth and
Yes,
sort of what
absolutely.
happens when I see them or engage with them. There's, neighborhood pets. I live in Colorado. There's all sorts of different animals. There's bears. There's deer out here. I'm going to be thinking about all of their teeth after this episode.
Yeah, I mean, it's really cool thing to think about. And I mean, what an amazing job that she just kind of fell into, right? Like, that's not what she started out doing. And yet it was really cool. And I don't know about you, but I'm sorry, if that tiger moved while I was in there, I'd probably be out the door too. I mean, that's just pretty amazing. And this challenge is pretty cool too, don't you think?
Very simple, but can take it much farther. Look up how many teeth a tiger has, and specifically how many of each type of tooth. Now, we want you to do this for this episode with tigers, so looking this up, but I can already imagine myself, and I imagine some other listeners. I'm not a dentist, like several of the ones we've had on the show. I am going to be looking in my own bathroom mirror and counting teeth in my own mouth.
Well, there you go. I mean, so you learn more things about perhaps your own teeth as well. So for any of you that want to share what you thought about the episode, or maybe if you've gone to the zoo and seen tigers and all that kind of stuff, you can tag us on our social media. We're at KidsSolve at Facebook, X, and Instagram. And don't forget to check out our website, solveitsciencepodcastforkids.com, where we have information about this episode and all of our other episodes. So you can go back and check everything. And you can also find out more information about each of our guests, which is pretty cool because you can learn more about their careers. And we've had lots of guests on the show, so be sure to check it out.
Solve It for Kids is the science podcast for kids and families. Until next time, you'll hear Jen and Jeff on Solve It for Kids.